All right, thanks for joining me today. We're going to do a quick tutorial on cirrhosis and how to manage your cirrhosis patients using your electronic medical record. One of the things, obviously, with COVID that we've run into is with patients not coming into the office as often, that there's a chance that some may fall through the cracks who are due for blood work or routine ultrasounds as part of cirrhosis follow-up. So I'm going to show you a few quick tips on how to make sure that these patients aren't falling through the cracks. So the first thing we need to do is to make sure that our data quality is up to par. So we need to make sure that our cirrhosis patients are being correctly labeled, and that and that's the key to making sure that we're not missing any of these patients. So the first thing we would do is I have a search here that we run that looks for any patients in their problem list or their history of past health who have the words either cirrhosis, HEP, fibrosis, encephalopathy, or liver, and who have not already been coded with an ICD-9 code as having the code 571. That's the one we use in our practice for tracking our cirrhosis patients. So again, this is an overly broad search, right? This is casting a wide net. A lot of these patients who have the word HEP in their chart may not actually have cirrhosis, of course. They may have just had hepatitis A in the past, or a hepatic adenoma, or so there's going to be patients who are going to show up in this search who don't actually have cirrhosis. But we've done this to cast a wide net. So you would run this search, and you would get a list come up, and this is a kind of a blank search that comes up here as an example, but your search will come up with a list of names here, and you'll go through the list of names, and you'll delete the ones who don't actually have cirrhosis. And once you have a list of those who have cirrhosis, you can actually code them all collectively. You go report, and then you go down to add problem for all found, and that brings up another window where you can actually add the ICD-9 code 571, and it puts it into all of those patients' charts, which is quite helpful, into their problem list. The other option is if you want to do that one by one. I'll show you here. We have a custom form that we've designed. It's a bit different than the one TELUS has. This is one specifically geared towards the quality improvement that we do in our office at the London Lambeth Faux. But this is the coding assistant here, and you would just click the word cirrhosis, and you would click finish, and that would then put that problem coded, and go through here, coded up in the problem list as cirrhosis. It's right up here. Okay, so let's put that in the chart automatically. You don't have to remember what the cirrhosis code is, because obviously there's so many ICD codes, and it's tough to remember which ones are for which and which conventions we use. So that's what we do for initially finding those patients. If for whatever reason down the road you want to, once you have a good cohort of patients that you've coded properly, you could go to another search that we have called LLFO CD cohort cirrhosis, and that finds all of your patients who've been coded as having cirrhosis. So again, review the CD search looks for, again, this is the search to find those patients with cirrhosis, and the cohort is those with cirrhosis. Okay, so once you've done that, then we want to, there's two components that we use for a quality purpose for cirrhosis patients. One is an ultrasound. So patients who have cirrhosis should be having an ultrasound every 6 months to screen for hepatocellular carcinoma. Okay, that's a standard practice. And what we've done here is we have a search that can be run every number of months or so. You can decide on your own practice in your office, but we've set it up here so that anybody who has been coded as having cirrhosis and who's not had either an ultrasound of their abdomen in the last 6 months, or let's say you just ordered a liver ultrasound, and I would recommend labeling those as a miscellaneous ultrasound and making sure you just have the word liver in the description. So if there's neither of those in the last 6 months and they have cirrhosis, when you run this search, this will find all of your patients who are due for a liver ultrasound. Because there's nothing worse, again, than a cirrhosis patient who gets neglected for a period of time and then ends up being diagnosed with late-stage hepatocellular carcinoma. So this is a good way of keeping on top of that. The other thing related to cirrhosis care that we'd recommend that you do is we've got a reminder set up here. So we go patient and down to reminder report. And if you search again for the word cirrhosis, we've got a search. This is a reminder. So again, this puts a reminder in the patient's chart if they have cirrhosis and have not had either an INR or a bilirubin or an albumin done in the last 6 months. So those liver function tests. if they're delinquent on any of those tests over the last 6 months, in their chart, it'll say the words cirrhosis blood work not up to date, Q6 months, albumin, bili, INR. So that'll show up in their chart, and you can also run a report. Let's say you want to see, okay, who are my patients who are due? Can I run a report on those? You can. This is the reminder report window. You'd click that. You'd click on your name, and then you click reminders, and that would give you that report. Okay, so 2 places it goes in the chart, but you can also run the report. Okay, so those are 2 things that we do related to cirrhosis care: making sure they're up to date on their blood work, making sure they're up to date on their ultrasounds. And again, it all comes from data quality first, because if you know your cohort of cirrhosis patients, then you can do this kind of work to make sure no one's falling through the cracks. Okay, thanks again for joining us, and the next one we'll be doing is around diabetes care, and expect that within the next week. Thanks for joining us. Bye now.